July 6th. CAAB meeting, nice and early, 8 a.m. Maybe we could take a quick minute and introduce each other. So let's take a look. Rebecca, do you want to use your list of board members this morning to do introductions? Starting with yourself.
I am Rebecca Royce, Clark County Community Services Staff Board. Next on the list is Beth Landry.
Good morning. This is Beth Landry with DCS staff.
And Bridget.
Good morning, it's Bridget McCleeman, and I'm community representative, I think it's District 2.
Good morning. Erica. Erica, you are muted.
Oh, sorry. Can you hear me?
Yes.
Okay. My thing is opposite. It's telling me mute that I'm muted right now. So, okay. I am Erica Hefter, District 3 Low Income Rep.
Good morning. Councillor Linda Glover. Councillor Glover, we're not able to hear you. We'll go ahead and move on. Hopefully we can get Councillor Glover's audio working. Oh, there we go. Good morning, Councillor Glover. Would you like to introduce yourself?
I'm muted.
We can hear you now.
Okay, Linda Glover, I'm Mayor Pro Tem of the City of Vancouver. Thank you.
Good morning. Megan.
Good morning. I am the low income representative for District 4 of Clark County.
Good morning. Melanie Green.
Hello, it's Melanie Green, and I'm the community representative in District 3.
Michael Torres.
Good morning, Michael Torres, Clark County Community Services staff.
Rob Perkins.
I am Rob Perkins, elected representative District 3.
And we have Peggy Sheehan as a visitor and our two sign language interpreters. And then we have our chair, Hopper.
Thank you so much, Rebecca. And again, good morning, everyone. You can see the slide that is on the screen being shared, but if you're on the phone and unable to see it, I just wanted to put into the record that this meeting is being recorded. So if you could identify yourself as we go through the meeting, if you are going to ask questions or talk. And we are not using the chat function this morning. We're doing that due to having to go back and disclose all chats for public records. It'll make our administrative lives so much better if we just use our audio function and not the chat function. With that, we'll go ahead and move forward to our first order of business for the board, and that's to consider approval of the May minutes. These were included in the invite as an attachment. Is there a motion to approve the May minutes I could consider?
So moved.
This is Melanie Green. I second the motion.
Thank you, Melanie. And who made that motion?
Bridget McCleeman.
Thank you, Bridget. So we have a motion and a second. Is there any discussion? Hearing none. By a voice call, all those in favor say aye.
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 Opposed? Okay, motion carries. Thank you so much. So for a second order of business, we had a subcommittee of this board work to review and bring forward proposed changes to our bylaws. Is there anyone from the bylaws committee that would be willing to share our process and the recommendation? And I know, Rob, you're on the call. You were a part of that committee.
I was a part of that committee. Apologize. I'm looking over our notes. So Rebecca, maybe you can help me a little bit along this line. This is just to summarize what it was we did and why, right?
Correct. If you'll
Okay.
indicate who is on the subcommittee, and I can pull up the minutes if that would be easier.
I'm struggling with the technology a little bit this morning. It's
I'll bring up the minute for
oh,
you.
bylaws. Okay, there is a bylaws update comparison doc in the email that came out on the 29th. And yeah, whatever administrative type help you can give me will certainly be useful. Because I can't remember the exact dates, but the subcommittee met 3 or 4 times to go over the bylaws and modify them. And our biggest 2 items of work that we thought of were a focus on equity and trying to clarify the term start and end dates for a member of the committee to maximize the kind of participation, but also continue with the practice of. I apologize the way I'm pausing here. I woke up like 15 minutes ago and had a pretty late night talking with my son who came over. It was to focus on clarifying elements of the bylaws and that focus on equity. And Rebecca or anybody else who was there, if you want to chime in if I miss a piece. What you're seeing on your screen now are the proposed changes. And the first.
And I do think, Rob, that this is Alicia, that Rebecca provided 2 documents, as you mentioned. One is our amendments that we're proposing, and then the second is the document that's fully incorporated as a final doc. So for today's consideration, we will be approving these not by change, but as an entire document.
Thank you. Yes.
And maybe if it would help, maybe Rebecca could give us just a quick overview of some of the highlights at a higher level, just to give the board some context. Would that help?
Yes, it would. Thank you. I appreciate you.
Yeah, no worries. So Rebecca.
Thank you. So we had a subcommittee of 4 board members and myself. So Alicia, Rob, Karen Kameroff, and Jamie, sorry, spaced her name for just a moment. So we met, approximately 4 times, go over, and hopefully you had a chance to review these before the meeting this morning. And what you would have seen is at the top, I made a comment of some of the high level changes that we made. Some of it's just formatting, which is already approved throughout the document. Some of it just word choice, just clarifying some minor things that didn't affect the actual intent of the bylaws. But as Rob had mentioned, there were 2 pretty big changes. One was really moving them towards using an equity lens in the document, and then how our appointments and reappointments work for the board. This version is the one that has the accepted changes with just comments about what was changed throughout. The first big change is our commitment to equity. This was based on the Department of Community Services statement that we have for our entire department. So we just feed that and put that into the bylaws. Here was just making sure that we were more clear and inclusive in the use of the who we're focusing our services to serve And you'll kind of see that throughout the entire document. If you recall the previous version, we listed out all of the different funding sources that we work with, but those change over time, and then we would have to change the bylaws. And so now we've just kind of made a more general statement about the use of funds that we'll be overseeing as the Community Action Advisory Board, to allow a little bit more flexibility. And then, as Rob was saying, our period of service has changed. So two components of this were, one, that all board members will apply at the end of each term, and we will open it up for new applicants. So it's an application process every 3 years. And then the other big change, and this required a code change actually, and which is why it took us a little bit longer to present these to the board. The previous version of the bylaws had, if a position was vacated, somebody else would come in and fill the remaining term for that vacated position. Instead, the subcommittee really wanted each new member to have an opportunity to have a relatively full term for 3 years when they first came on the board, so that they could have time to learn all of the things that happen with the Community Action Advisory Board. And so now the bylaws state that the person will come in and they will start their own new term from when the date they're appointed through the December 31st of the 3rd year after that. And this really makes it so we don't have new board members that are only on the board for 3-4 months and then having to reapply for their position. So that was the second major change that went to the board, or to the bylaws. The rest of these were more clarifying changes. One thing that we didn't really clarify too much is what is considered an absence from a meeting. So here we defined what being absent to any individual meeting means, and what it looks like if you are absent from many or more meetings that would create a vacancy on the board. We matched our non-discrimination statement to the county's discrimination statement, so that is consistent with the county. And again, most of this was word choice and minor formatting issues. And then just making sure that we were more clear in the statements that we made so that they were easier to read. So that is a general overview of the changes to the bylaw.
Thank you, Rebecca, and thank you, Rob. It was a long weekend and appreciate you being here with us. Is there any questions from the board regarding our proposed changes?
I don't have, sorry. I don't have a question about the content. I was just interested in how come the code change went to council on June 15th prior to us adopting it as a recommended change. It just seemed backwards. I was kind of surprised. I happened to be listening and I heard that it came from the Community Action Advisory Board, and I didn't recall us voting on it. So it just seemed back to front, and I wondered if there was a reason.
So I checked in with our prosecutor. So everything that has been changed has been reviewed by our prosecuting attorney. So that's one first thing, to make sure that we weren't doing anything we couldn't. And their recommendation was to do the code change before you guys adopted.
So if we voted it down, what would happen?
That's a good question. And I could ask our prosecuting attorney. I just went based on what our prosecuting attorney had said was the order of getting these approved. So,
Rebecca,
This is
if I
Michael.
may.
Yeah, what I believe would happen is that one thing's the ordinance. The ordinance needs to allow the bylaws to operate as they are structured. So the ordinance change made that possible. It doesn't force the bylaw to act this way. So if you voted this down, we'd remain with the existing bylaws until we somehow changed it. But So it's not, the ordinance change itself did not force the change in the bylaws, and they're not fundamentally incompatible, if that makes any sense. From previous discussion with the prosecuting attorney, though, we would have to either, we would have to do an update to our bylaws to make sure that there is clarity around the terms, like the terms that are being served, and also what the process is for reappointment. So even if this were voted down, we would still have to continue to discuss and address those two issues.
Fine, I just get, I don't have a problem with the language, obviously. I was just surprised when I heard it was a public hearing and that I had, as a member of that board, I hadn't even heard about it, although clearly we've discussed and I didn't disagree. So I just raised the issue because sometimes I think the board could be more involved with council than it is. Thank you. I'll shut up now.
So, yes, I agree that the sense that I had of that process was that in order to change the bylaws, the code had to change, and not that we're reviewing this after council made sure that the wording was legally enforceable and so on and so forth. Because we did really put a lot of time into adjusting the language to make it less exclusive. Things like removing unexcused absence from the language. That's in section 4. Just to make sure that the document, that the bylaws acknowledge that it's more difficult for some people to come to a meeting than it is others. But that's the sense that we really brought into it, is how can we be inclusive? How can we be more inclusive in our bylaws to try and take a stab at implicit biases?
I have a question. Can you hear me?
Yes, go ahead, David.
Okay. And maybe I apologize for me being about 4 minutes late. I'm here now. I had a problem with my internet. So it's funny you're talking about problems trying to access the meeting. I have a question on Article 4, Section E. We've changed a lot of equity wording that I approve of, but I have a question about clarity on the one where you change disability to other ability. Is that going to be clear? Because I know we're not trying to hurt people or anything, but let me read it, excluding the other words. It would say special attention should be provided to increasing awareness for people who face obstacles because of their other ability. And to me, if I put myself out of this and I read that, that's not clear, other ability. I understand that people want to avoid the word disability. In the deaf community, we have deaf plus people that they didn't even like the sign for disability and they want to change it to a D with a drop down list, which you can't do in English. But I don't know that other ability is going to be really clear, and we're trying to do clarity. So I'd love to hear your discussion on that. Thank you.
Does anyone from the subcommittee want to address that discussion? I know we had, a pretty good discussion on that.
I think we have Karen on the line. She was on the committee, and I'm not sure if Rob wants to add any additional thoughts.
I remember the discussion, and I remember actually discussing pretty much exactly that. Is that your memory of it too, Alicia?
Yeah, I think it was exactly to David's point.
Right.
And wordsmithing is definitely a difficult task, and we try to be as inclusive as possible. But I would say under today's discussion, if there's something that is not perfect and somebody wants to make an amendment to the bylaws as presented, that is open for consideration. So David, do you have a suggestion? If other ability doesn't seem like the right term, do you have a proposal?
Well, my proposal may not be perfect, but you know, the English language isn't perfect. And again, in the community, for the disability community itself, it's everywhere. Kind of like people from any kind of group aren't always in agreement. If we want clarity, maybe we could say something like people with disabilities and other different abilities, but it gets kind of muddled. I would propose we just go back to disabilities and make it clear that way, because it's either disabilities, or we could say, we could do like a politically correct thing and say that other people disabled, but it gets kind of murky, and everybody would understand what you mean when you say people who are disabled. So that would be my proposal, to put in that people with disabilities.
Would it make sense if we just struck the word other and it would read?
Okay, read that to me.
Certainly, it would say special attention should be provided to increase awareness for people who face obstacles because of their ability versus ability.
Yeah, abilities.
Plural?
Plural, I think, because there can be more than one thing. What do you guys think about that? Can we have discussion?
It's a good insight. This is Rob. I think it's a good insight, and it reads clearer the way David proposes it. The question I'd have for the others is whether it keeps the meaning in the larger sentence: people who face obstacles because of their race, sex, age, ability, familial status, sexual orientation, gender identity, etc. And reading it aloud just like this suggests to me that it would be clearer without the word other. To that end, I'll second a motion to strike the word other from that sentence.
Well, what we'll do is actually, once we've had full discussion, we'll propose a motion.
Okay.
And then when we're up for discussion, I think we'll have a second motion on the amendment.
Okay, thank you.
Okay,
Thank
just
you.
tell me when you need me to talk and I will. Thank you.
Thank you so much, David. Any other discussion from the board? Is there any other discussion from the board regarding the bylaws? Okay, hearing none, I want to thank Bridget and David for their questions and for taking the time to review. For the full board, the way that we will move forward for adopting these is we will have a motion, and actually, I think before, since we just had discussion, I'm going to retract that. I think we will accept an amendment first, a motion for an amendment. And then when the amendment is adopted, we'll have a motion on the complete document. So Rob, this would be the time you can make your motion, and then David, if you still wanted to second your amendment, then we can do that.
Okay, do you want me to propose the amendment?
If you would like.
Okay. I propose that we amend for, what was it, Article 4, Section E, to strike the word other before the word ability. And
Thank you.
were we going to change to abilities or leave it ability, which is clear?
A singular, I think.
Okay, so just strike the word other next to ability. That is my proposal.
Thank you. The motion on the floor. Is there a second?
There is. I second.
I'll second.
Okay. Thank you. I think Rob hit the second, and we have a motion from David to strike the word other in section 4E. Any discussion? Hearing none, let's go ahead and take a roll call vote of board members for that amendment. Rebecca, if you could call the roll.
Yes, sorry, Bridget,
Yes.
David,
Yes.
Erica,
Yes.
Karen? Karen, are you able? Hopefully she'll be able to get audio. We'll move on. Counselor Glover?
Yes.
Megan? Megan?
Yes, I vote yes.
Melanie?
Yes.
Rob?
Yes.
And we'll go back to Karen. Are you able to give audio? Doesn't sound like it, but we do have enough yays and a quorum.
Okay. Oh, Karen says, I apologize, I'm having tech difficulties, but yes, what she put in the chat, but I'm not sure if we can count that without audio voice, but thank you, Karen. So we do have a majority to approve the amendment. So the amendment carries. Now for consideration of the full document, which includes the amendment, I would accept or entertain a motion.
This is Melanie, and I make a motion to accept the document in its entirety with the amendment.
Second.
Thank you. And that was Bridget on the second. So we have a motion and a second. Any additional discussion? Hearing none, we'll do roll call.
Bridget?
Yes.
David?
Yes.
Erica?
Yes.
Karen, are you still having technical difficulties?
I think I've got a little bit of it figured out. I'm here.
Do you approve the bylaws?
Yes.
Counselor Glover?
Yes.
Megan?
Yes.
Melanie's
Yes.
and Rob?
Yes.
That's everyone.
Okay, so that is a majority of the board, so the motion carries. And sorry for the additional diligence in doing the motion on both the amendment and the full document, but I think these are our guiding bylaws and governing documents, and it's incredibly important for all of us to have buy-in and have our votes on the record. So with that, thank you to the committee for their time and the review, and thank you to Rebecca for all of the hard work. It was a major undertaking to review these bylaws, and we really did put in a lot of time. So just thank you so much. Moving on, we have a report from Michael Torres on our homeless crisis response system and the COVID request for application update. So with that, Michael.
Good morning, everyone. Michael Torres of Clark County Community Services. So on June 1st, Alicia Topper and myself presented to the County Council the recommendations of the CAAB Application Review Committee for the request for applications that we put out earlier this year for the Homeless Crisis Response System COVID funds. That was just over $2 million worth of funding. The county council approved the CAAB Review Committee's funding recommendations unanimously. And just as a reminder, that is $1,210,012 for rapid rehousing. $836,253 of that is for a share rapid rehousing program. $373,759 of that is for the YWCA Safe Choice Rapid Rehousing Program. Then for outreach and engagement, there were a total of $507,808 recommended to be funded in two different programs. Share Outreach is going to be receiving $240,000 of these funds from the RFA, and Outsiders in Project Hope is coming in with a new program to our community. So that's very exciting at $267,808. Council for the Homeless is going to have an outreach and engagement, a system coordination function that was funded at $160,000. And finally, the Community Services Northwest CMAR with their SOAR, the SSI, SSDI outreach program that helps eligible people receive SSI, SSDI benefits is also being funded for $73,000. So all of those contracts have been drafted and are with our contracts team right now. I believe some have actually already gone out for signature, and they will be in effect starting July 1st. Any questions?
Question says,
Oh,
Linda
go ahead.
Glover.
Go ahead.
I'm just curious, in these proposals, is there funding for ongoing assistance once somebody is housed, helping them be able to cope in that new setting for them?
So yes, all of our rapid rehousing programs for the homeless crisis response system. So these are funds that are specifically targeting people who are experiencing homelessness, which is different than all the eviction rental assistance funding that you hear about, which is really targeting people who are currently housed, have a lease with their landlord. You know, their main obstacle is economic. But for all our homeless programs, part of the funds is the direct financial assistance, but part of the program is also the housing stability supports, and that's a requirement that we have in all our contracts.
Another follow-up question: what kind of accountability do we have that assistance is effective, or it continues as long as the client needs it? Do we get any kind of feedback on that?
We do, and in a couple ways. So one way is we do require reports from all our contractors on a quarterly basis that talks about like their activities and their outcomes. We do require, as I believe the CAAB knows, we also require all our service providers to get customer feedback directly, and we present that to the board annually. And in addition to that, we require all our service providers in the homeless system to enter their information in HMIS. And if you go right now to the Council for the Homeless about homelessness, their system data, system information webpage, you can actually see the performance system-wide and of every specific program in terms of, you know, how many people are coming into the program from chronic homelessness? How long are they in the program? What is the percentage of exits to successful housing, to permanent housing? I'm sorry. So by and large, our rapid rehousing programs are very, and also what are the number of, the percentage of returns to homelessness within 2 years after someone has exited the program. And by and large, the homeless programs in this community, and specifically the rapid rehousing programs, are very successful.
Thank you, Linda. I think, David, did you have a question?
Yes, I just want to know the list of people who won the bids and are being proposed to the council to have the new contracts. Do we have a list of that we can visually see?
We do, and I'll ask Rebecca to email it out to everyone if you do not have it already.
Thanks.
Thank you, David. Are there any other questions for Michael? Okay.
Next on our agenda is the outcomes report. So this will answer or show a little bit of the information that Councilor Glover was asking about. I'm going to switch over really quick to the report.
Thank you, Rebecca. I was talking away on mute. Thank you to Linda and David for their questions, and to Michael for the invitation to present with him to the County Council. To Bridget's point, we're working hard to make sure that we're represented when presenting in front of the board. So yes, on to the next agenda item.
Oh, sometimes technology is great and sometimes it's not so great. So this is the report that we've been providing to you on a regular basis that goes over all of the programs and the outcomes of each of the programs. As you can see here, we are on the second year and we're on Q3 that started July 1st, 2020 and goes through March 31st, 2021. This again is just the different funding that are reported within this report itself. The first area that we look at is the participant satisfaction. As we've been mentioning over the past few reports, the participation rate had declined quite a bit as the different agencies were learning how to do things a little differently during the pandemic and not having the one-on-one case management as they had in the past. We can now see that that response rate is increasing again. We are up to an 11.4% response rate, and just over 82% indicated a positive overall experience. Again, we asked the agencies to let us know if they had a positive or if they had a neutral or negative response, and that's how we indicate how we're doing as a system in this report. And then we also wanted to add in some of the comments that the agencies received over the last quarter. One was that they really appreciated the help, kindness, and respect that was given to me. Another loved the program. It was so helpful in the time they needed it. And then one program reported that some participants were expressing frustration around the length of time getting into programs, which, is been in a situation that we've dealt with for a really long time, but especially during the pandemic when we don't have any turnover in units and agencies are helping households for a much longer time to make sure that they remain stable. It's understandable that there's frustration from participants that really want to get into housing programs. So this is just the bigger overview of what we are actually funding, what programs are being funded. This is the community action programs and then the homeless crisis response system programs. You can see there's a wide variety of programs that are funded under every single intervention type. As we move into the expenditures, we would expect the all our programs to be around 75% spent out in Q3. And you can see for the most part, they are. As typical, the hunger response program has there's 100% spent out in the third quarter because they do spend these funds and then they use their foundation dollars to supplement the program. And everybody else is doing well. When we look at the homeless crisis response system, you can see that a lot of them are right around in that 75%, but some of these programs also received other funding that was COVID specific, which they then had to focus on spending those dollars first because they have very limited time frame for them to be able to be spent out. And then two other programs I wanted to call out, the Janice Ascend program, which is here. At just over 40%. This program provides hotel assistance to youth, and typically they use it when they are getting ready to enter one of the housing programs so that they can stabilize the youth, be able to find them to make sure that they can get all of the barriers addressed before they go into an actual apartment unit. And because there's been less turnover in the programs, they haven't been adding new program participants into the program as frequently, and therefore not spending those funds as often. They've also received significant funding from different foundations in the community, and they've been using those dollars as well. The second program I wanted to highlight was Second Step Housing, and they are a little bit behind on their spending. They've actually overspent in their operations and underspent in their rent assistance. They will be continuing the program for 1 more year before we do the request for application. However, they'll be continuing the program with the existing funds that they have. When we look at the community action system for performance and the total people served, you can see that the health and social behavioral health category, which includes food, which is the majority of the services there, is significantly overachieving because of the pandemic. The Clark County Food Bank they almost met their annual targets within the first quarter because of such demand in food assistance. And then the Partners in Careers Career Academy program is still struggling to get people into the program to do the workshop series for a myriad of reasons because of the pandemic. One reason is that people are just not ready to go back to work because they were still taking care of their kids at home and things like that. So they are working on different marketing techniques to ramp up the program again. So look at some of the highlights from our community action programs. The Fresh Alliance program, which is the program that collects foods from grocery stores rather than them being thrown out. They've now received over 1 million pounds of food this year, which is basically 6 1/3 space shuttles. So it's quite a bit of food so far this year. The Volunteer Lawyers program has helped 96 households avoid eviction. And yes, there was still evictions happening, even though there was the moratorium. There were reasons that people could be evicted, and they helped mediate and keep people from losing their housing. 28 people improved their credit scores, and then over 400 people resolved their legal issues because of the help with the Volunteer Lawyers program. FAIR's Hunger Response Program provided over 78,000 meals at Share House. They continue to be serving those that are hungry out of that facility. So they've done significant work there. And then Janus Youth, with their Oak Ridge Youth Shelters, they've helped 46 youth exit out of the shelter and back into stable housing. The homeless crisis response system, again, Michael had mentioned the dashboards that are available on Council for the Homeless, where you can get a myriad of information, which we don't report here because you have easy access to it through their website. Here's the website address for that if you're interested in going there. But it is easy to find if you go to councilforthehomeless.org. Looking at the total people served in the different program or intervention types, the core system programs, that includes the Housing Solutions Center. And because of the significant funding in eviction prevention, they have received many calls and done a lot of services there. And you can see a lot of the other programs are staying the course and helping the households that are already in their programs. And some have been able to increase their capacity in their programs and have seen a little bit of turnover. The targeted prevention, this is low now that because they are been doing the services through the additional COVID funding. So programs to know, again, I mentioned the Housing Solutions Center and then permanent supportive housing programs. For them, they don't typically have too much turnover, so we typically see most of their households entered in the beginning of the reporting cycle. And then I'd already talked about second step housing with that program. The other outcome that we pay attention to is households are maintaining or increasing their income. That's very important so that they can become stable and exit the programs. So here I'll focus on the percent of the programs are doing quite well. Permanent supportive housing, they have been able to help a few more households maintain, and with some of the other supports that are going on, more households were able to maintain their income than had been predicted before the pandemic began. And then just a quick overview of the demographics of the program. So this is all of our programs, everybody that is entered into the homeless management information system. That information is collected so we can give you just an idea of who is being served in our community. So when we look at race, we had over 5,500 responses. So that indicated that they indicated what their race is. Some they have the ability to refuse or indicate that they don't know, and then that information is not calculated in these responses. And so this will just give you an overview of who is being served within the community. And I'll make sure to send this report out in the follow-up email so that you can take a closer look at the report. Any questions for me on this report?
This is David Poland.
Hi, David.
It's not really a question, just a matter of clarification for the record. If anyone was not aware, I ran into this when I was enumerating for the census, and I've read about it happening before, that if we have people that are identified as homeless and they're doing point in time count, and then they're asked what their race is, if they are Latino or Latina, they may be confused by that, because a lot of different cultures outside of the United States don't designate races like we do here. So if we have some of those people that immigrated here, they may not respond as a race. They might say that they are Latino or Hispanic or something like that, but they might not say if they are Black or white version, because they don't really think of it in that terms. A lot of them will say Native American for things, but a lot of times in America, we thumbs down that unless you know a tribe, and a lot of times they don't require having exactly what percentage of a tribe that you are. So I think sometimes our system has the best intentions to know how many people are here, fit into marginalized categories, but it doesn't always work for some people out from outside the United States culture. So we don't really get a good picture of what they really look like to our eyes, because they don't care. I hope that helps.
Thank you, David. Any other questions or comments about the report?
Kind of a newcomer comment, Rebecca, if I may, or question rather. Is the report going to appear on the Community Services website for access by others?
It will, yes, it'll be with the minutes with the documents for the meeting.
Excellent. Okay, thank you.
That reminds me, has that overall picture, the community needs assessment or the community report, I forget which one I'm talking about. Did we complete that? Has that gone out to the public?
So I think there are two reports that we've done in the past, Bridget. One is the community needs assessment that you guys adopted at the May meeting, and it is with our communications department. They've been slammed with a lot of things, and I will take ownership on some of that. It took me a while to go back and answer questions. It is in process, and we're hoping to have it very soon. And we will make sure that we send it out to all the board members and then put it on our website. But we're also this year going to have it translated into the 5 languages that we did the survey in, and have that available for people too. So there'll be a little bit of extra work going on once the final report is designed. The wording is essentially done. Our communications department had very, very minor tweaks. Like, honestly, it was just, we used the word averse instead of adverse, that type of thing, to make sure that everything was beautifully clear. Otherwise, we're working on a lot of the graphics and the charts and the things like that that really go into the report to help give it some robust meaning for people as they read it. So it will be coming very soon. The other report that
I was just confused about which was which, because this looks really good, by the way. I like this format. So.
Oh, that's great, because I know we've changed it around over the last few years.
Yeah.
The other report that we've done in the past that we haven't had a chance because of capacity issues is the report to the community, which is kind of an overall assessment, overall review of what had been going on in the previous year. And I do really want to get back to doing that report. Capacity is, there's been a lot going on in our unit at work, and a lot of funding going on. So I do want to get back to there. So I will hopefully have that for you guys in the future to then start doing that on a regular basis also.
Thank you. Any other questions from the board? Okay, great report. Thank you, Rebecca. We have a guest from the city of Vancouver with us this morning, Peggy Sheehan. She's going to provide us an update on the city's Affordable Housing Fund and their homeless response. Welcome, Peggy. Are you still with us today, Peggy?
Hello.
Hi.
This is Peggy. Can you hear me now?
Yes.
Good to hear all you folks. Thanks for all the great information. So I wanted to share with you all that the Community Roots project out on Fruit Valley Road, they expect to be moving units on later this month, and with their they're going to have a grand opening scheduled for the end of September. I believe it's the 22nd. So I'll make sure you folks all get an invite to that. As some of you might be aware, it's a project that's funded by the city, and also they were one of the few organizations in the state that received a modular home grant. So they'll be moving modular units. They're all single small units that are built out in Battleground by Wolf Industries. And we're pretty excited for that project to be moving forward. It's gotten a lot of attention because it's totally all of the work and the materials are being produced in Clark County. And it's a small board, very new organization. So we're really excited about that project. And I know that the city has an RFP out for, let me just read that to you, for supported campsites. And some of you might be aware that there are, I'm sure all of you are aware of the many different campsites around the community that are currently people that are homeless are staying at. And it's on the city website. And I can, if you're interested in that, it's the City of Vancouver Procurement Portal website if you want to look at that. And I can also send that to you if you'd like. And where the city uses the Be Heard website. So if you go to City of Vancouver and click on Be Heard, we're looking for feedback on our homeless response plan. And we've also contracted with Outsiders In to provide mail service. And they'll be distributing mail now 5 days a week at 2 different locations. And I think that's all I have right now. If you have any questions, feel free.
Any questions from the board?
Yes, please. If there's a way to get the links and so forth to those sites, I could use the help getting to the
Great.
information.
I'll send those to Rebecca right now.
Appreciate it. Thank you.
No problem.
Any other questions? I do have one quick question. Maybe it's not a quick question, Peggy. What will the accessibility be for the sanctioned campsites? What are the restrictions or I don't know, the codes of conduct that will be enforced? I know I've read quite a bit in the paper about it and heard people talking about it, but it would be nice to get the city's kind of description of what those encampments will entail.
Yeah, and maybe what I can do is I can send that to you all. If whatever we have that's already developed, I'll send it. I'll send you an update to that.
So there's already a kind of a white paper or a formal program description designed?
Yeah, and I'm not as informed about this project as I should be, and so I don't want to misquote anything. So if you don't mind, I'll just send you something in the next, some before the end of the day. I'll send it over to Rebecca, and we can do.
Okay. All right. Thank you, Peggy.
And I do know that we are planning on trying to be as flexible as we can, and we'll be looking at when we when we do contract with how we can work that out with the particular provider.
Okay, I'll look forward to seeing that information.
Yeah, yeah.
Any other questions
Sorry
for
about
Peggy?
that.
No, that's okay. Okay, hearing none. Thank you so much for joining us, Peggy. It's always nice to hear what's happening
Yeah.
in the county.
Thank you.
With that, we'll go ahead and move on to our legislative update. I believe Michael Torres will be giving us both a state and federal report this morning.
Good morning, Michael Torres, Clark County Community Services again. There really is very little to report right now, as you can imagine, at the state level, not in terms of legislation, but a lot of the activity internally among different staffs and with policymakers and with the Department of Commerce revolves around the governor's end to the eviction moratorium and the bridge, and what are the guidances and the guidelines and obligations around that. So we are engaged pretty heavily both with the Department of Commerce and internally in terms of just making sure that we understand what the governor's guidance is and that we are in compliance with it. And in fact, Rebecca, myself, and our prosecuting attorney have a meeting to just kind of go over the governor's bridge plan line by line tomorrow morning, and so we can move forward accordingly. So not about legislation, but yes, about policy, and certainly policy that affects has a pretty big local effect. On the federal side, most of the activity you will see over the summer revolves around the president's budget and how that will translate to the actual appropriations. So just as a quick brief, the president's budget really includes regular spending items and COVID-related COVID response and economic recovery related emergency spending. So on the regular side, on issues of homelessness and poverty that are notable, the president proposed $500 million in homelessness funding. That is a significant increase over the usual budget for homelessness funding, which generally comes out to about $140 million. So I mean, it is a significant increase. The regular budget also from the president also includes $4.7 billion for tenant-based rental assistance and housing choice vouchers. On the emergency spending legislation side, the proposed budget includes $2 billion for project-based rental assistance, $318 billion to increase the supply of housing, especially affordable housing, and included in that $318 billion is $26 billion for new permanent supportive housing, $70 billion for public housing, and $40 billion for the National Trust Fund, National Housing Trust Fund. And finally, $400 billion for Medicare to help subsidize medical costs of low-income people. So, over the summer, I think a lot of conversation and negotiation and calls for legislative action are really going to revolve around those topics and, adjusting those numbers, to see what passes in legislation. Any questions?
Any questions from the board? Okay, hearing
Thank
none. Thank you, Michael. We have a 2021 point in time count and Homeless Connect report. And I believe we have Dale Whitley with us from Council for the Homeless.
Hello.
Good morning.
Good morning.
The floor is all yours.
Am I able to share my screen, or do I need Rebecca to open my PowerPoint?
I think Rebecca will be able to give you the ability
You should have the ability now.
Okay, can everybody see that?
It's coming. There it is.
Yes.
Excellent. So yes, I'm Dale Whitley. I am the Homeless Management Information System Administrator with the Council for the Homeless. So we, with the Council for the Homeless, we administer the HMIS system, and we also coordinate the annual point-in-time homeless count. So for anyone who's not aware, I'm going to give you an overview of what the point-in-time count is. So it's intended to be a single night snapshot of everyone who's homeless in our continuum of care. It's required by both HUD and Washington Department of Commerce. So HUD requires every other year count, and the Washington Department of Commerce requires an annual count. So we do it annually. It's used to review trends. I kind of think about like a high water mark on a river, where they mark whether the river is low or high. That's once a year we produce this number, and then we're able to compare those numbers to previous years and see how the populations are trending. Every year we try and utilize new tools and increase the effectiveness in the count as best we can. In the past, we've recently started using mobile apps so that we can do surveys that way in the field. We don't have to use paper survey forms anymore. So that helps a lot. That's one example of that. And then the point-in-time count can help to enable better planning and funding determinations going forward. And one thing to keep in mind always with the point-in-time count, that it's the best available data. It's always considered an undercount because we have to do it in one day. We always know that there are some people that are unfortunately going to be missed. But that's why every year we try and become more effective at the count that we do perform on that one day to try and make sure that everybody, as many people as possible, can be counted. So the data sources that we use for the point-in-time count, the point-in-time count it's separated into two major sections. One is the sheltered count, and we get those numbers from our HMIS system because all the shelters and transitional housing programs in our county, they enter their client data into our HMIS system, so we can just pull a report for that day, verify with the agencies that those numbers were correct, and then get those numbers there. Any non-HMIS shelters, we will provide paper survey forms to collect that information, or use the mobile app to get the information there. So that's how we produce the sheltered side of the count. The unsheltered is what takes a lot of the effort. That's where we have teams. We have to do a lot of coordination with all of the non-HMIS service locations in our community. We'll provide them either paper forms or access to so that they can provide their information for the day of the count. So any like food banks or libraries, those are all examples of locations where we're counting people. The Safe Park program, they provide their information for the people that were staying in their safe parking overnight programs for the night of the count. And then the school district homeless liaisons, they report their numbers for the families that they're working with. And one of the biggest pieces of coordination that is involved is the street count. So we have, like in previous years, we've had like 13 to 16 teams that go out and scour. They are assigned zones within our county, and they walk around and they check the previously identified locations where people are known to be, and ask people to complete the survey there. So that's always like that's what takes a lot of our planning efforts, and it's an amazing turnout. Those teams are composed of our outreach workers, which are amazing, and staff from agencies, and just local community volunteers, and elected officials. All those people will make up these various teams that go around and do that count in most years. And then the Project Homeless Connect event. So this is a one-day service fair that we hold. Previous years, it's usually been at St. Joseph's Church most recently. And lots of agencies are there available to provide lots of services to people. There's haircuts, there's clothing, there's dental care and eyeglasses and vision, all kinds of things that are provided. Hot meal usually at that Project Homeless Connect, and that's where we're able to gather a lot of our surveys from people who are pulled into this magnet event. So that's how we usually do it in most years. So unfortunately, as we all know, COVID affected a lot of things for all of us this year, and it affected the point in time count as well. So HUD, in preparation for this, made available and out of concern a waiver for the unsheltered count because those Project Homeless Connect events and those street count outreach teams would necessitate a lot of close contact among people. HUD gave a waiver to COCs, and almost all of them, including ourselves, accepted that waiver for the unsheltered count in 2021. So for this 2021 point in time count, we only have a sheltered count. So we still collected all that information from the shelters and transitional housing. But even among the shelters, COVID also had its effect we experienced reduced bed capacity due to social distancing restrictions. So they weren't able to have the full number of beds that they would normally. And we also heard and experienced in the numbers that there were less people staying at some of the shelters, particularly some of the family shelter, the winter overflow shelters, out of social distancing concern. People chose not to go to a congregate shelter. And so, yeah, the shelter numbers were affected in that way. So here's an overview of the 2021 shelter point in time count results. These are number of people by shelter type. So in the upper row, you can see the number from the previous year, January 30th. There were 268 people in the emergency shelter. And in this year's count, there were 213, which was a 20.5% decrease from the previous year. Transitional, there was actually an increase of last year was 132 people, and this year was 162. That was because we had a new transitional housing shelter that was open with the Exchange Church. And then so the combined emergency plus transitional in January of 2020, that was 400 people, and in January of 2021, 375, so a 6.25% decrease overall. So here's some of the subpopulations within those sheltered numbers. So for chronic individuals, you can see it was pretty much the same from last year to this year, 70 and 69 people, decrease of 1. For chronic families, last year there was one household of 5 people, and this year there were 4 households with 16 total people. So that was an increase in the number of chronic families. Veterans last year were 22 total people, and in 2021 it was 16. Seniors 62 plus. Last year was 24, and this year 23. So pretty close. This is a number that I've been keeping an eye on because it seems to be keeps creeping up. So yeah, so bear in mind, these are just the sheltered numbers on just this one day, January 28th. So next steps for next year's count. It'll take place on a Thursday during the last weeks of January 2022. HUD, the part of the requirements of the point in time count, it always has to be during the last 2 weeks of January. And our planning meetings will begin in late October or early November. And hopefully this year we'll be able to return to that full Project Homeless Connect, which is really a wonderful event. I'd love to see that be able to come back. And the unsheltered count as well, the street count, all the other ways that we're able to perform that unsheltered count. So we will need volunteers for that. If you know of anybody who would like to volunteer, please let me know, and we can get you connected to a team or do the Project Homeless Connect event. We'd also looking forward to need to integrate any new outreach resources that will be available coming up, as well as new shelters. So we'll have those included in the count. So these numbers will change quite a bit as we have additional shelter capacity. But so the point in time count is one source of data that we have. And again, it's limited to just that one day. So there's only so much it can tell us. But so I wanted to make everyone aware of the other reports that we have available at councilforthehomeless.org under our About Homelessness section. So for one, we have our 2020 annual system data report. So this looks at not just one day, but for all of 2020, how many people were homeless, how many people called for shelter, how many people were placed into a program, and you can follow them through the system. And there's lots of wonderful information there as well. So this is all available publicly on our website. We also have a system dashboard that we update monthly, and you can, with that dashboard, you can view by program type. You could look at just emergency shelters and see how their outcomes are performing, transitional housing and permanent housing, those other kind of program types. You can go program by program, or you can actually click on a specific agency's program to see how their outcomes are. We also have an equity dashboard available on our About Homelessness section as well, where you can see how our BIPOC communities score, for instance, in our coordinated assessment compared to the white members of our community, or people who have disabilities, how they score. And so yeah, and we also have our 2021 housing inventory chart available, and that has a listing of all the different shelter and transitional housing programs in our community and how many beds they have available. And we also have our homeless action plan was recently updated. That's a wonderful report. So that's been updated for 2020. So you can use that to see a listing of what the trends, outcomes, and challenges and responses are for our response system. And I can show you some of those reports afterwards if we have time. Any questions?
Are there any questions?
1,000 questions, but not enough time for that. May I ask whether your definition of homeless is similar to or different than the McKinney-Vento definitions that schools need to use?
So it's HUD's definition of homelessness. So it doesn't include doubled up or living with family and friends.
Because the doubled up and an unstable housing sort of category under McKinney-Vento is the grand portion of those according to the OSPI reports, right? I guess the question here is, have I understood that correctly? Is that those who are doubled up, the kids and their families, are not included in your reports, but they are included in the OSPI reports and the school district reports?
Yeah, that would probably be correct. Yeah, and especially those numbers that I was specifically showing for the point in time count, those were just sheltered people. So those would be literally homeless people, even by HUD's definition.
Unhoused altogether. Thank you.
Any other questions? Well, that was a really thorough report. It'll be nice to be back in a environment where we're able to actually get out and do a full count and make sure we're reaching all of our unhoused neighbors. Okay, before we let you off the hook, one last chance for questions from the board. Okay, hearing none, thank you so much, Dale. We appreciate your time this morning and always appreciate the work of Council for the Homeless. Send back our regards to your team. With that, I have one other item on our agenda this morning, and that is an opportunity for those from the public to provide questions or feedback. We have an open forum on our agenda this morning. Is there any members of the public that wish to discuss or share with us this morning? Are there any members of the public who wish to address the board this morning? Okay, hearing none, I'm going to close public comment, open forum, and move on to other business. First, our next meeting is going to be on September 7th, and that will be from 8 a.m. until 9:30, and it will still be virtual via WebEx. But I do think there will be a point, Rebecca, where we'll want to discuss how we'll be moving forward with our board meetings, whether it's going to be a hybrid or in person or continue meeting virtually. So I think maybe September would be a really good time for us to have that discussion moving closer to 2022. Is there anything else for the good of the order from the board?
I can give just a little bit more detail about the virtual meetings. So the Center for Community Health, we've been directed that our advisory boards will remain.
I'm so sorry to interrupt. The only reason I'm doing it is because what you know and what you're about to change based on what I have informed you last week has changed. So there definitely needs to be some more discussion, exactly as Alicia Topper is suggesting, in terms of what is the way forward. Are we going to go to a hybrid? When? And that's just based on some guidance. So some new information from public health and their utilization of the conference rooms and Center for Community Health. That's changing. Originally, they've had those all the conference rooms and Center for Community Health booked and with equipment in it through the end of the year, but that is changing. And also on Thursday, I got some updated guidance from the prosecuting attorney regarding what is changing with the governor's emergency order and public meetings that we still need to process and figure out. So I apologize for interrupting you, Rebecca. It's just that I didn't, you don't know that yet. Like, we haven't had an opportunity to talk, and it was so close to this meeting that I did not want to throw any wrenches in there. So more to come, Alicia, exactly as your state.
Perfect. Yeah, I know that there's what we really need to do as a board is make sure we're adhering to all the Open Public Meeting Act requirements, and the governor's proclamation really predicates how we're going to facilitate and manage our meetings. So I think by September we should have really strong direction, and I think that would be a good time for us to formally lay out what our plans are. So thank you for that, and thank you, Rebecca. I know you're always like spot on keeping us informed, so we appreciate that. Okay, well, we are about 10 minutes early. Again, is there any other items for good of the order before we adjourn this morning?
Rebecca, could we talk offline afterwards? Maybe just a phone call.
Yes.
Oh.
Okay, thank you. It's just administrative is all. It's not part of the order, but I didn't perceive another way to ask.
Thanks, Rob. No problem. Okay, hearing nothing from the board, thank you to all of you for joining us this morning. Hope you have a fabulous week and you're able to enjoy all this wonderful weather we've been getting. So with that, the meeting is adjourned. Have a great day, everyone.
Thank you.